Did you know that every 1 out of 19 male or females will be diagnosed with this disease? I'm talking about colon cancer. Good evening, my name is Gregory Zarian and this is Healthline. Colon cancer is known as the silent killer. It doesn't know a face, so it could affect males, females. Statistically, it's if you're of the age of 50 and over, but actually it really doesn't know an age. Over 10 years ago, Katie Couric from the Today Show's husband, Jay Monahan, was diagnosed at the age of 42. He was asymptomatic, and as I read earlier today, he was just living his life with his family, his wife and his 2 daughters. And he never thought of getting screened because it's something that he just never thought of doing. Because of that, in the year 2000, Katie Couric actually went and did a colonoscopy live on the Today Show. The colonoscopies speaked double. So now everyone is getting checked for it. If you or someone you love is suffering from symptoms that we will discuss of this deadly disease, go get checked. Colon cancer also has a celebrity behind it. Elizabeth Montgomery, Bewitched fame, died at the age of 62, and she only found out 8 weeks before that. Pope John Paul II, Walter Matthau, and even the beloved Audrey Hepburn has died from this disease. It kills people. Again, as I've said, it is a silent killer, and the one way to be checked and prevent it is to get screened and get a colonoscopy. When I say the word colonoscopy, most people are afraid of actually going in, having a conversation, and getting checked. 10 seconds of discomfort will save your life. Let me introduce my first guest, medical oncologist and chairman of the Committee of Cancer at Glendale Adventist Medical Center, Dr. Boris Bagdasarian. Welcome, Dr. Bagdasarian. How are you?
Thank you. It's an honor to be here tonight.
It is a pleasure to have you. Did I list your credentials
Yes, absolutely.
appropriately?
Absolutely correct.
What got you involved in the study of cancer, much less colon cancer?
Well, unfortunately, I lost my grandmother at a young age, and that was one of the main motivating reasons why I became a cancer specialist. And throughout my years of medical training, my main emphasis was in becoming an oncologist. And over the past 25 years or so, we've seen some major improvements in detection, prevention, and treatment of this deadly disease.
Doctor, how old were you when your grandmother passed away?
I was 8 years old.
And how old was your grandmother?
My grandmother was only in her early 60s.
Was she asymptomatic as well, or she actually had some symptoms?
She was symptomatic, unfortunately, at an advanced stage. She died of ovarian cancer, which is unfortunately a difficult disease still today in identifying in the early stages. We don't have actual screening tools, but in the next 5 to 10 years, that'll certainly change.
Well, I'm sorry about your grandmother, which then made you a specialist in your field. Let's just start really quickly, doctor, and I'm sure we all know this, but the colon. What is the colon? Where is the colon?
The colon is an important part of our gastrointestinal tract. Its general function is to form stool. And there's a lot of water absorption that takes place.
It's equivalent to a car wash.
Yes, pretty much.
What I've read.
A variety of different minerals are absorbed through the colon, but the main function is to excrete all the waste generally. It's a storage site. And that's the majority of where the carcinogenesis, the development of cancer, takes place in the majority of our GI tract versus the small intestines. The function generally is to have bowel movements on a daily basis. Unfortunately, a lot of patients, as they get older and due to a variety of medications, constipation, the longer stool stays within the colon, the higher the likelihood and exposure to carcinogens, and hence the mutations that take place, which leads to the development of cancer.
Thank you, Dr. Bagdasarian. Don't go away. More on signs and symptoms of colon cancer when we come back.
As a new nurse, Glendale Adventist helps me meet my patients' needs with compassion and confidence. I feel called to care.
As part of a highly skilled team, I'm counted on to save lives and make a critical difference to my patients and their families every day. I feel called to care.
I've been a nurse here for more than 20 years and have been given the chance to learn and grow. I'm doing what I love and love what I do. The opportunities at Glendale Adventist are endless. I am called to care.
Welcome back to Healthline. I am Gregory Zarian. You can catch us here every Tuesday night from 7 to 7:30 on Charter Channel 380. And we're also on the web at glendaleadventist.com/Healthline. And as you know, we have our very own YouTube channel at GAMC Healthline. Now, before the break, we introed this episode tonight on colon cancer. Colon cancer has at least 150,000 diagnoses a year between men and women. It knows no sex or age, because as time goes on, people that are younger than 50 are getting diagnosed. That's why I have my first guest here, Dr. Boris Bagdasarian. He's a medical oncologist, and he's in charge of the cancer committee at Glendale Adventist Medical Center. Thank you for still being here with me.
Thank you.
Dr. Bagdasarian, out of the gate, signs and symptoms that people look for in regards to colon cancer.
Well, one of the signs and symptoms that we are looking for are patients who present with bright red blood. Usually bright red blood per rectum is one of the signs. Now, some patients may have hemorrhoids, which at times they can have hemorrhoidal bleeding, but that really shouldn't be a reason for not seeking medical attention. Now, if that's associated with abdominal pain, cramps, the sensation of bloating, not having bowel movements that usually are on a typical schedule, are some signs that you need to bring to your attention of your physician.
So they're large causes for concern. When you say bright red bleeding, is it just like a random experience, or is it more consistent?
It's usually a consistent. If there's intermittent bleeding from a polyp or a tumor, that's usually not as commonly seen. It's usually continuous bleeding on and off throughout the day. It could be in small amounts. It could be large amounts of blood, depending on the location, the size of the tumor, or the lesion that we're dealing with. Now, if you're dealing with an upper intestinal bleed, for example, an ulcer, by the time the blood passes through the bowels and it's expelled,
it's dissipated a bit, right?
It's dissipated and takes on a dark melanotic, what we call melanotic discoloration, where the stools are tarry or black colored, and hence that's usually at higher in the GI tract. If it's usually bright red, we're a little concerned about that. So that's a red flag that warrants further workup, and going to your primary care physician is extremely important.
So then you're basically saying that if someone at home or someone you love is suffering from any of these symptoms, we're talking about a change in stool, bright red blood, bloating, gas, and it seems more consistent to actually call your doctor and make an appointment, not so much to just say, hi, I need to go in and get a colonoscopy, but just to share every bit of information with your doctor.
Absolutely.
Because it could be it basically could be gas, it could be a hemorrhoid,
Correct.
It could be a simple impairment that you're suffering from. That could even
don't
be
take
stress.
things in your own hands and leave it to a professional to make their assessment in terms of what additional studies are necessary.
Do you find that a lot of people take their own diagnosis into their own hands?
Unfortunately, there are many people, and it depends on which ethnic background, to the level of sophistication. But for the most part, we do our best to educate the general population in the do's and don'ts and what they need to key in on as red flags and bring it to the attention of their healthcare.
Thank you, Doctor. Doctor, since we're such an ethnic community, do you find that there are differences in incidence rates among the different cultures?
Yes, that's an excellent question.
Thank you.
I'd like to answer that. Unfortunately, in some of the old school, for example, here in Glendale, we have a large population of Armenians. A lot of the old school, older Armenians tend to shy away from seeing their primary physicians and don't follow important
because they have their old country remedies.
They have their own country remedies, and there's also a lot of fear. If they feel something in their breast, they really don't want to bring it to the attention of their physician, and they feel that their home remedies could ameliorate and dissolve whatever
But it's also
changes
fear
that
to
they
find
have.
out what could possibly be wrong. Because my mother unfortunately passed away she died from esophageal cancer. And she came from the school of not wanting to know what was going on with her. Is that the same thing here with what you're discussing?
Exactly. And so as community-based physicians, we're doing our best in educating the Armenian population about cancer screening, about prevention, dietary changes, and this is done through many means: television shows, public forums, through a variety of different Armenian Medical Society events, etc. So this is has changed, interestingly, in the past several years, because people are now listening, and the younger generation
Or talking to the parents
talking
more so.
to their parents, their grandparents, and opening their eyes and seeing the light really is.
But also, it's more of a conversation. I'm finding that my brothers and I speak a lot more to my older family members more than they spoke to us, just because it is a cultural thing.
Absolutely.
Doctor, go back to diet. Are we healthy here in regards to a diet in our area, or no?
Well, it depends where you live in the United States. As you know, Californians are looked at as the healthy state where everybody's
40% of this country is obese. So let's
40,
focus on
a
community.
In our community. Well, our community really, unfortunately, hasn't adapted the national guidelines, and that is to consume low-fat, high-fiber diet.
What does that mean? Let's break it down.
That means that we want to veer away from the westernized diet, which has generally been consuming high-fat foods,
and
the red meats, the hamburgers, the fried foods, and
Did you say fright or fried?
Fried.
But to your body, it's fright foods.
That's right, exactly. And with less bulk and fruits and vegetables. So we have to basically move away from that and start consuming a lot healthier foods. I would recommend for people to consume meat perhaps once or twice a month.
Okay.
And if they can comprise 50% of their daily meals with fruits and vegetables. And
5 servings, isn't it? 5
that's
servings a day.
5 servings, absolutely.
And 5 servings means fruits and vegetables. And I've had a great
All the
doctor,
grains that are
a very
important.
colorful plate.
Yes, absolutely. That would basically lead to a healthy lifestyle and prolong your survival and decrease the morbidity, not only of any incidence of developing colon cancer, but a variety of other malignancies, which have been tied to the high-fiber diet, high-fat diet.
But one thing I also want to throw out there too is leading a sedentary lifestyle can also cause many types of illnesses and cancers and stuff. Lack of mobility,
Lack of exercise
movement,
and mobility,
all of that.
correct.
Absolutely.
Yeah, well, a lot of patients do become obese, and there was a large trial that was conducted by one of my mentors, as a matter of fact, where they looked at 5,000 women who were obese and or had a poor diet versus those who were lean and ate a healthy diet. Over 10 years, 30% increase in risk of developing malignancy in those individuals. And that's across the boards: colon cancer, breast cancer, ovarian cancer. So diet and exercise is extremely important in leading to a healthy.
So basically what you're saying, doctor, is a colorful plate, a healthy lifestyle, and a lot of exercise, and just paying attention to your body. Don't go away. Stay tuned for my second part on colon cancer.
When is time your enemy? When a stroke first occurs. It is critical to know the symptoms of stroke. Vision change, loss of balance, dizziness, weakness or paralysis, difficulty speaking or understanding speech. Your best chance for a full recovery requires immediate medical care. That's why Glendale Adventist has a state-of-the-art stroke center dedicated to the best and fastest treatment. Because with stroke, time loss is brain loss. Glendale Adventist Medical Center. Healthcare at a higher level.
Welcome back, and on tonight's topic, we are talking about colon cancer. Colon cancer is known as the silent killer. A few statistics: someone dies every 9.3 minutes from colon cancer, and also more than 50,000 people die every year. And colon cancer doesn't decipher itself. It's male and female diagnosed. Now, my second guest is a surgeon from Glendale Adventist Medical Center. He's a gastrointestinal surgeon. His name is Dr. Atta Mazaheri. Welcome, doctor. It is a pleasure having you here.
Thank you for having me.
What got you involved in gastrointestinal studies?
Well, the field of gastrointestinal surgery was something that I became passionate about because of one of the mentors had decided to have a surgeon that can do both colorectal surgery and gastric and esophageal surgery, which required 2 fellowships. And then after that, I combined that with minimally invasive surgery as a 3rd fellowship. And I think it's a very interesting combination because you can do both oncological resections for cancer and benign resections, and you can do it in a minimally invasive fashion that patients can have a faster recovery and go home sooner to the loved ones.
Since we are talking tonight about colon cancer, what are some of the treatments that you specialize in?
Well, the treatment of colon cancer as a whole is a multimodality treatment.
When you say modality, what does that mean?
It means it needs multiple disciplines to be involved. It requires a surgeon, an oncologist, and a gastroenterologist.
So you basically need a team.
You need a team
Okay.
to approach this in a very good fashion, and usually a patient will be seen and referred to an oncologist, or an oncologist will see a patient from a gastroenterologist and refer to a colorectal cancer. And the whole point of it is to try to diagnose what it is, what stage it is, and decide what is the best treatment approach to go forward with its treatment.
So first of all, just what I'm really enjoying that you're saying is that the patient also needs to be safe with their doctors, with their oncologists, with their gastrointestinal specialists, to feel safe with everything that you're talking about. So once you come up to a plan.
For sure. The autonomy of every treatment is always with the patient. We just provide them with information, and they will decide whether they will go ahead with the treatments that we have planned in mind for them.
So let's break down what is a treatment for colon cancer?
Okay. It depends on the stage that the patient is going to present. If a patient comes with a small little polyp that is less than 2 centimeters,
Which is the size per se of an almond.
correct.
A little bigger than that.
And it can be removed by a gastroenterologist via a colonoscopy. That's a treatment, depending on the grade that we'll have by the pathologist.
And most people need to also know that if a polyp is found,
Correct.
it's not always cancerous. It can be benign.
Absolutely.
And the first stages, first 1 and 2, are most likely benign.
Correct. There is a grading system for
Okay.
polyps that depends on the pathologist and the layer of the involvement of the polyp to what he gives back to a report to us that we make those decisions. Now, if a gastroenterologist scopes a patient and finds a mass that's 3 to 4 centimeters fungating, then the patient needs to go through staging. In a staging process, if the stage of the cancer is high, it will need neoadjuvant chemotherapy. That means he needs to see an oncologist first to shrink that tumor per se, or then followed by a resection, and then followed by more chemotherapy. That's why we present these patients at tumor boards, that all people involved agree on the plan and make sure that nothing's missed in terms of the treatment.
Dr. Umanakami, you said staging. What does that mean?
Well, staging means where is the cancer, how big the tumor is, has it involved other parts of the body or organs, and how should we go about treatment of it.
So but where the tumor starts is really important, isn't it? Why is that?
Well, if a tumor, for example, is a grade 2 tumor and has not involved other organs.
Or gone into lymph nodes.
Correct,
and stuff
lymph
like that. Okay.
nodes, the liver is not spread. If it's near an ovary, the ovary is not involved, and the pelvic floor is not involved, and it's a smaller tumor. At times you can just do a surgical curative resection, and then once you get the pathology report back on that, you can send that to an oncologist to see whether the patient requires further chemotherapy. However, if this is a rectal cancer and it's close to the sphincter area and it's a 4 or 5 centimeter tumor, you can shrink that and then resect it. So you give it chemotherapy first, make the tumor smaller, and then resect it so you can preserve the sphincter so the patient have fecal continence and will not become incontinent. That's why it's very important to present these patients in a multi-modality system, that you have a good treatment plan and options for them.
What do you find is the biggest problem with patients coming into you? Do you find it's lack of conversation? Do you find it's withholding something? Do you find it's fear of sharing with you what the symptoms are? What do you find is the biggest problem with patients?
Well, unfortunately, cancer is a very scary word. I actually
Can you say that again?
It's something that scares people.
It scares everybody.
I mean, I remember while I was a medical student, one of the projects I had was the psychology of cancer. What does it mean when you tell someone you have cancer? And when we looked at these patients, that when they were told the word cancer, they just stopped listening to you.
Doctor, what does it mean?
Well, basically, cancer, could it be really scary? Yes, it could be. But could it be treated? Yes, it could be. Is it a death sentence? Not necessarily. So what matters mostly is prevention and screening, knowing when to come to see a doctor. And we've made multiple strides and improvements in the treatment of colorectal cancer, its prevention, its screening modalities. And I think one of the best things you can do for patients outside is to educate educate, and educate.
Okay, so doctor, screening. Let's discuss screening. When does someone come in to get screened for colon cancer?
Well, the question that you ask is a very big question, but I'm going to try to narrow it down so it's simplified answer.
Please.
If a normal male or a female that does not have any genetic predisposition to cancers in the family, at the age of 50, recommendations today is you need a colonoscopy. So you should see a gastrointestinal and have a colonoscopy done to see if there's any polyps or you have a clean colon. And that gives you a lot of information. There are people who say, well, there's some errors with colonoscopies. Yes, that's correct. You can have 10%, 15% loss or missed polyp, right? That's still better than no screening
But
at all.
bottom line, if you are the age of 50 with no history of colon cancer in your family, go get
You
a
should have a
colonoscopy.
screening, correct.
Period.
Yes.
Other things.
Well, there's the diet.
Okay.
The red meats we know is a bad thing to do all the time. The more roughage and fruits you have is better for you. Basically, what I always tell patients is you need a sound, healthy bowel habit. And you patients know what that means. No heart stools, no too much straining, no meat all the time. If you have a balanced, healthy lifestyle with a balanced diet, with screening, that will be done by the guidelines of the NIH or the National Cancer Institute, you should be just fine. And unfortunately, there are those that have a genetic predisposition. Well, we have different modalities of picking those up.
And if
we
that
have literature
happens,
on
just
that.
pay attention to what the disposition is and
Correct.
go get checked. Thank you very much for being here, Dr. Mazaheri. Please stay with us for my wrap-up on colon cancer.
How do we recognize perfection? How do we attain it? For over a century, we've provided the best healthcare in Glendale by striving for perfection. And now we've made the biggest upgrade in our history. The latest technology, the best physicians, brought together in our new state-of-the-art digital campus. All in our quest for the only perfection that matters, you. Glendale Adventist Medical Center. Healthcare at a higher level.
Welcome back, and thank you for joining me for our wrap-up. We spent the entire time talking about colon cancer. A little while ago, we discussed treatment, and Dr. Bagdasarian has agreed to stay with me for my wrap-up. Dr. Bagdasarian, please share with us more treatments that are present today for colon cancer.
Well, it's in the past 5 years, we've seen some breakthroughs. Breakthroughs in that, in the metastatic setting, where majority of patients were deemed incurable or unresectable, where if, for example, if they were to have 1 or 2 or perhaps up to 5+ tumors within their liver, were, I would say, about less than 5% of those patients ever got to a point where they can potentially remove those tumors.
Really?
Because of the burden of disease. There's several novel agents. These cancer cells produce growth factors, a variety of different growth factors, one of which is the vascular endothelial growth factor, which we abbreviate as VEGF, which allows the cancer cells to basically be nourished, leading to the production of blood vessels that will provide the nourishment. At the same time, these blood vessels are basically a route for these cancer cells to spread to distant locations. So a novel new drug called Avastin or bevacizumab is an antibody that basically binds to these growth factors in the pool of where these cancer cells are residing and dividing, and eliminates that signal. Thereby, after months and months of using these agents, you clearly can see a regression in the numerous small blood vessels. At the same time, the concentration of chemotherapy, which is arriving at where the main tumor is significantly higher because of the regression of all the small blood vessels.
Okay.
The pressure in the main blood vessel is much higher, so it's a win-win situation. So you're keeping the cancer pretty much in its tracks, not allowing it to metastasize and spread to other locations, increasing the concentration of the chemotherapy that is bombarding the tumor. At the same time, cutting off the blood supply, you're cutting off the nutrients. So with these novel agents and a variety of other similar novel agents, we've seen some very impressive responses to where patients were 5 years ago were deemed unresectable are now being deemed resectable, meaning they can potentially go through curative surgeries. And I can tell you that less than 5% rate of surgery has gone up to 20 to 25%.
Isn't it
in some cases, which is phenomenal. And some of these patients have gone to be cured, where unfortunately they would have.
Where 5 years ago would have been a
they
different
would have
conversation.
succumbed to the disease. That's right.
Dr. Bagdasarian, what are your strongest preventative tactics in regards to colon cancer?
First and foremost, you need to see your family practitioner or internist on an annual basis.
Get screened.
And to go through your screening. We recommend screening to start at age 50 for those who have no risk factors, but those who have hereditary colon cancer in their family need to be screened at a much younger age.
Age such as what, 40?
Generally, we would recommend starting around age in their 30s,
Okay.
or even sooner, depending on the type of hereditary condition.
But then also pay attention to symptoms that we discussed earlier. If there's anything that seems out of the normal for you or someone you love, go get screened, because it's 10 minutes out of your life to get screened.
Precisely. That, combined with a healthy diet rich in fruits and vegetables, high fiber, low fat diet, leading a stress-free life, exercise, and there's some information about use of aspirin, which decreases the production of polyps, which are precancerous lesions. These are all combined, really the general recommendation from the American Cancer Society in cancer prevention, and especially colon cancer. So this is a golden recommendation that I can give you.
Thank you, Dr. Bagdasarian, for your time and your expertise. And thank you for spending this time with us and our topic on colon cancer. Go get screened, because at the end of the day, the most important thing you have in your life is your health. I'm Gregory Zarin on behalf of myself and everyone here at Healthline. Have a great night and be well.